Dr. Ackley. So I'm going to fire some to you first of all. What professional lab or labs do you recommend for DIY mold kits? So my patients who can't afford several $1,000 mold inspection tests can test their home themselves.
You know, mold testing for a home is really complicated, and sometimes you can lose more money by not doing it correctly. So I wanted to start out, I saw that question. Frequently, we recommend dust testing from mycometrics or envirobiomics, but it's a hint. It doesn't always mean if it's a low number that it's really okay. When it's a very high number, it usually does mean there's trouble. So it's a pretty complicated subject. Actually, people spend their careers doing this and learning to do it. And I did want to make a plug here for ICI, the International Society of Environmentally Acquired Illness. Keith and I were co-founders. That we have a whole society, very active education going on with what we call the indoor environmental experts who do this, go into homes like building biologists and test. So the short answer is yes, you can use dust test. I really don't advise mold plates because there's a lot of benign mold that can be picked up on those plates. And that if you start with the dust test, you don't really have a complete answer. Visual inspection is real helpful, and it's a complicated subject that has bedeviled many, many people into thinking they were okay when they weren't, or thinking they were in terrible shape when they really weren't. So
thank you.
That's the best answer I can get, is be cautious.
Yeah. I just want to add in a small announcement as well for anyone who might be panicking that we won't get through all the questions. We are saving all these questions, and I think be putting some kind of answer sheet together for the ones that we don't manage to get through, and we recognise are really excellent questions. Another one for Dr. Ackley here. Is there any information on foods and food products that are known to have mold toxins? And she's not asking about grains, which are known to contain mold, but that could be contributory factor to psychiatric illness. So foods that might be more likely to contribute to psychiatric disease.
So I think there are two parts to the question. One, do foods have molds? And yes, a number of foods are known to have some molds that grow on them. And they're not great. They certainly contribute to leaky gut in some people. But most people who've been treating mold illness, this complex of many, many symptoms, feel the greatest contribution to mold illness is the environment, is inhalational. It's the mold in the walls, the mold in the air that really provides the most inflammation. So it's not saying no foods aren't important, but a much greater contribution would be what's behind the walls. And so, again, a complicated question, and one that also bears a lot more research too.
Thank you. There's a question here about VIP, and I wanted to share this one because I was interested in knowing a little bit more about that as well. So could you expand a little bit on your treatments using VIP, briefly, unfortunately?
Right. VIP is vasoactive intestinal peptide, and I've been using it for a number of years. For mold illness, it's a smooth muscle relaxer. It's a natural bioidentical hormone. It's extremely useful for the lungs. Very often we see subclinical pulmonary hypertension in mold illness, where there's fibrosis in the lungs. The diffusion of oxygen is limited, and that can be picked up by testing. VIP is incredibly helpful with that. So it's not surprising that the Israelis went to it when we're looking for COVID remedies, started using it IV, and have been able to get people off respirators. So it's now under investigation in the US for the same and being used for that. You can still buy it in compound pharmacies, but it's useful for the lungs. Anytime you improve oxygen flow, you're really going to help your brain too. And it does have a number of other properties that are cognitively useful. So many people use it in decreasing inflammation and systemic effects for mold as they recover.
Given that, have you got any experience with using it for patients who are very clearly electromagnetically hypersensitive. Have you got any specific anecdotes there?
Most of my patients who have electronic sensitivity, which is probably at least 50 to 70%, are also seeing me. Mold is very involved. So healing has involved getting them out of mold, healing mold, everything you've heard about here. So VIP can be useful, but I would never say it would be used by itself to heal electronic sensitivity. People can react to it, probably have some histaminergic issues, and it wouldn't be my first choice at all with someone who was sensitive to electronics.
Thank you. I've got some questions here for Keith Bernstein, but I guess he's not with us. I can't see him on the panel. So Dr. Ackley, would it be all right if I come back to you with those a little later?
Sure.
I'll move on now so that we can kind of vary the discussion. And by the way, panelists that I can see you with the video on, if you want to chip in on any of these discussions, just put your hand up nice and clear like this, because then I can see you and I'll bring you into the answers. So some questions here for Sheena Symington.
Mm-hmm.
When testing the effects of Wi-Fi, how do the results differ for healthy controls compared with those who already have EHS?
That's a good question. So with Dr. Havis's research, 40% of the people that she tested responded with the HRV provocation. And so that's where that percentage comes from. And 30% of the diabetics reacted with lowered blood sugar when she filtered out dirty electricity. And 35% of teachers responded within a school environment when they removed dirty electricity, because everybody wants to know what percentage of the population exhibits symptoms. And so that's where some of those numbers come from for Dr. Magda Havis.
That's really interesting, isn't it? I think this is actually a really important question. And we need more studies like this. And I think the other thing we need to understand is, which is along very similar lines, is if people are suffering, for example, with unusual headaches that we would normally link with suspicion of something like a space occupying lesion, are those people more likely to develop that pathology? Or, you know, with an appropriate avoidance protocol, are they actually less likely than somebody in the general population? These are massively important questions when we're looking at long-term outcomes and therapy, which I think is highly relevant to this question. So thank you to you, and thank you to Magda for doing that research, because we certainly need some more of that. Another one here for you. If a patient says a leak is caused, oh no, this is actually, this is more of a mold question. So I'll direct this back to Dr. Ackley. If a parent says a leak is caused basement, it's hard to read this one. What's the most effective way essentially to clean up a leak if it appears in a limited place?
This is a perfect question to join ICI and get on the IEP list and get 6 different professional opinions about the best way to do it. Again, it's pretty complicated. I mean, my first answer is stop the leak. The first thing with all of this is you have to stop the water intrusion. You can't just clean up and let it keep coming each spring. Then there are multiple ways to clean, but most of them involve ripping everything out down to the studs, cleaning it and starting over, and making sure leaks can't happen again with drainage. And that's a very short and obviously expensive answer. If you're asking, is there a cheap way to do this? No.
We'll direct them to your website then to get more information about that. And this one is back to Sheena Symington. So this, I think, is a great question, actually. Regarding your comment that Wi-Fi routers in schools can be turned down to 16% and still provide good functionality, does that intervention cause the connecting device to boost its wireless antenna power and thus increase emissions from that device? And that to me is getting at this concept of adaptive power control. So I guess depends on the device, but I'll let you come back to that.
It is a great question, and there isn't that blanket answer. That's why it's so important to measure it, because sometimes when you power down the router that the device is trying to connect to, like you say, the device will try harder to connect to it. But what we were doing in the schools is powering down the routers, and then no devices were being used within that space, that classroom. And so again, you really want to measure it. You want to measure it with multiple devices on, You want to measure that you are indeed having the effect that you want to. There's very great attenuation. There's very little Wi-Fi exposure in neighboring classrooms if the walls are really, really thick. But if they're a very flimsy wall, it's going to go right through. So you really just need to measure that your remediation efforts are really indeed having the effect you want.
I think for something with adaptive power control like a phone, it's definitely going to upregulate in that situation. I think most tablets, from what I gather, don't have adaptive power control, in which case they've got a limited, and they're actually always broadcasting on maximum, which is obviously not desirable. But I'm thinking, Paul Hiru, you might have some thoughts here. Have you got anything to contribute to that one?
Could you repeat the question, please?
We were talking about whether if you down-regulate the intensity of a router emission, whether the device is trying to use that router would upregulate their power output.
Well, if the router is down-regulating its emission power, essentially the receiver can increase its gain, but essentially there's no reason why it would increase its emission power to the router, because that uplink hasn't changed. What has changed here is the downlink. So I would think that the technique that is described here has a good chance of being very effective.
Great, that's good to hear. Dr. Goldberg, I've got lots of really excellent questions for you, so I think yours are going to definitely spill over into the ones that we save, but I'll get started. Question here saying, are you saying that E. coli studied have adapted to background RF exposure by genetically selecting for increased survival and virulence?
Yes, and I actually answered that one in the chat. That person got it exactly correct. Just I need to mention that all of these studies were short-term studies. They were max 24, 48 hours of exposure, but we have every reason to believe that bacteria are going to do, evolutionarily speaking, they're going to try to survive. So that's what they're going to try to do. Be more virulent and survive.
Isn't it? Now, for all of you, if you picked something up in the chat screen, feel free to move me on and direct people there to have a look at the outcome. This is an interesting one. Can significant decreases in EMF exposure improve the course of Crohn's disease?
Well, based on everything that we're learning, it really seems, since EMF exposure disrupts so many normal physiologic mechanisms in the body, it disrupts homeostasis at multiple levels. We have every reason to think that it would help, but it's impossible to predict for any given person. I'm not aware of any studies showing that it improves outcomes, but in Crohn's disease. But another interesting thing that was brought up at the conference earlier is that RF, that the tissues that are most, and cells that are most affected are those that are dividing rapidly and reproducing rapidly. So GI epithelial cells, why not? So that's my answer.
Did you, just out of interest, Dr. Goldberg, did you see the question in the Q&A about a viral resistance and I'm guessing mutation potentially as well? Did you see that question?
There were a couple of questions about COVID, and I really can't comment on the effects on EMF effects on viruses, because I haven't read about it. But it all comes back to our overall health and resilience, and we need a healthy microbiome to be it's just one of the pieces of the puzzle. So whatever we can do to improve our overall health is going to improve our resilience and our immunity with regards to coronavirus. But no, I didn't read any literature on viruses. And because they're difficult to study. I mean, the organisms that I presented on, it's not just that E. coli is such an important organism, or Staph aureus. The organisms get studied because they're studyable, because they're easy to work with, they can be cultured. But the talk about I get a lot of questions about studies on molds, and I know, Dr. Ackerley, you're our expert, and it's so great to hear your talk. but it's hard to study mold, right? I mean, it takes forever to grow. When you send a culture in the hospital, sometimes it'll take a month and a half, and often nothing grows. So that's what the literature reflects.
It's pretty much true.
And coming back to Dr. Ackley, I just want to say a personal massive thank you for the way that you've brought environmental medicine so strongly into your psychiatric practice. And it's something that I actually started off, my entire intention with my medical degree was to be a psychiatrist. And what pushed me away from that was I could very visibly see a huge overdependence on quick fixes, pharmacological therapies, which just felt instinctively wrong, even though I was very young and at the beginning of my training. And I really want to see the kind of psychiatry that you're practicing increasing, and healthy spaces, in psychiatric units as well as other areas of the hospital. We need it everywhere, don't we? Starting with that, NICU, the fact that we talked earlier about the fact that they have made a NICU department in Cyprus now low EMF, and I'm guessing if they're doing that, they're looking at other environmental issues like mold at the same time to try. Old hospitals in England have a real issue with that potentially. Dr. Goldberg, coming back to you, there's one here about Dietrich Klinghart's work. It says research in Switzerland on fungi showed a 600-fold increase in mycotoxin production compared to fungi inside a Faraday cage. Did you find research of a similar increase in bacterial biotoxins when exposed to EMF?
It's a really good question. And I didn't see any studies that were covering that were talking about toxin levels. I didn't see it. It doesn't mean that they don't exist, but it's not something that I saw.
Okay. And I've got one here for Dr. Hiro. Is anyone studying Li-Fi for biological effects on humans and the environment? I'm a product designer, and I think Li-Fi can have some applications to replace Wi-Fi. I think this is a really excellent and poignant question. Would you care to respond?
Okay, this is especially in the context of this conference and the information we got on the various effects of various frequencies of light. It's very, very pertinent. And of course, the answer is that the people who are developing Li-Fi are concerned with putting a new product on the market as a substitute for something that is starting to have a bad reputation. So very few studies have been done on Li-Fi specifically, but we could gather from the literature on light. That being said, all biological systems have lived under the sun for a long time. So my own promotion of Li-Fi is based on the simple principle that something that we have been confronted with, whatever the modulation, should be less deleterious than something that's entirely new that biosystems have never seen. And we have been living with these infrared controllers for various devices, and we haven't seen yet reports that they were doing something wrong. So I am optimistic, but as a scientist, I can't be certain. Thank you.
I've got a question of my own to follow on from that, which I'm interested in. If you're using LED light, we know that color temperature is very important, and we need to try and emulate a daylight spectrum as close as possible. But is that also true of the light that comes from LEDs? Is varying color temperature through the day actually making a difference in terms of less physiological impact? Do we know?
I think there's a fairly large literature on this, and that the people who have been using screens have been using a variety of techniques. How effective they are should be measured in terms of the melatonin levels and so on. Are these strategies favoring the natural cycles, or are they having a negligible effect? I don't know of any definitive studies on this subject, but if you're using Dell lights, you should first suppress the noisy electricity that can be issued by them. And second, you should worry about their color, as you mentioned. Thank you.
I think one of the things I was getting at there was the use of these blue blockers, etc., using filters from LED light, and so literally all you're changing is the color temperature. But yeah, interesting. And I think we've got Joshua Rosenthal in the audience as well, so he might have some things to add to that in the chat that we'd all be interested to hear. I've got a question for Dr. Marett here. So energy medicine has really accepted non-thermal effects for a very substantially longer periods than we're seeing evolving in the conventional medical forum. Have you got any comments on that?
Energy medicine, in terms of what's now studied by the National Institute of Integrative Medicine, that's in the NIH, is really one of the stepchildren. There's much more in terms of alternative and what's now considered to be more popular, like biofield therapies, nutritional therapies that are talked about also at this conference. Energy medicine is still relatively young, and some of the things I talked about are really more pioneering. I think in the long term, when we start seeing that the whole body is electrical in nature and communicates through light and through the coherence in water, we'll start to understand some of the mechanisms that are not being understood when we only look at either thermal effects or penetration depths and so on that are now presently going on. You asked about light. When we go to the blue part of the spectrum where the biophotons communicate, that's also more energetic light. And so when the screens give off more blue part of the spectrum, they really create more oxidative stress in the eyes, lead to potentially more macular degeneration and other things like that. That's why blue blocker glasses and so on are trying to prevent that, not only interrupting melatonin production, but also having an adverse oxidative effect. And then I really liked what Dr. Goldberg talked about, what's going on in the gut. We have these barrier systems in the body, in the gut, in the brain, and in the respiratory system. And with so much, for example, glyphosate, which is in all the water now and so on, they interrupt the microbiota in the gut. They really interrupt the synthesis of tryptophan and phenylalanine in the gut, the shikimate pathway. And so, there's this perfect storm now between things like Roundup and glyphosate in our food supply, our water supply, and electromagnetic radiation. And I think until we start seeing energy medicine becoming more widely understood in the largest context, and not just some of these applications towards therapeutics, then people can say, okay, how can you talk about no non-thermal effects from telecommunications technologies and all these positive effects when we use low-level non-thermal energy in energy medicine? So I think it's really a wake-up call to humanity, and especially to the medical profession, to integrate these new biophysics approaches into this discussion.
Thank you. I couldn't agree more. And I think we're taking a glimpse into the future with so many of these lectures. Magda, I'm going to come to you in just one sec. So I'm just going to read out this because I think this is such a good question for you, Dr. Marett. With respect to EMF dosimetry, what are the effects of pulsing EMF modulation compared with average measurements?
Well, Rob Metzinger talked about that yesterday, showed a picture. I think this is extremely important. We use dosimeters from Germany, from a company called Marshak Electronics, and studied it in children in schools. You can watch a video. I gave a presentation at the Commonwealth Club of California in 2015. That's on Vimeo, and I think can be found through Electromagnetic Health website from Camilla Reese. And we showed how high the pulsing levels, the transients, the spikes that were coming off. And when you only have a regulatory standard that goes from minimum or maximum of 30 minutes and only looks at the time average RMS values, that is the root mean square values, then you start really understanding that the standards are totally not biologically based, because biological systems really very much are responsive to these sudden transients, to the peaks. You know, biological systems adapt to changing systems rather than constant systems. And so these peaks are grossly understudied. There are certainly unique dosimeters on people's bodies, and we found in children in schools that are really being affected by these peaks with their electrical sensitivity. And we even gave expert testimony in a court case, and now it's accepted in the United States in a court case in Massachusetts from a child that was hypersensitive in schools. So I'd suggest you look at that video perhaps and look at the data there. These peaks are much, much higher than the root mean square values. And so the root mean square values are important only for heating, but for biological effects, you need to look at the peaks and the transients and the pulse radiations, which are increasing daily.
Thank you. And Magda, I know you had a question.
Yes, it's for Carl as well. Carl, is there good evidence that you can put frequency or an information into water and then benefit by it if you happen to ingest it? Is there any good research on that?
Not by drinking of it, but you can put frequencies in, and it acts in a homeopathic manner. We're studying this right now. You really want to see that water has special, when it's treated magnetically or with electrical processes. Dr. Benveniste, the late Benveniste, did studies with water that was imprinted with frequencies, and they were actually transmitted over the internet. And they did have an effect on physiological systems and cell cultures. I don't know anybody studying that for ingesting that, but I think that's a future area of research, very important.
Thank you
Luc
so much.
Montagnier is studying that actually.
Mm-hmm.
I'm disappointed to say we've run out of time, and I had so much more to ask.